Please let me know if it is seen by everyone properly. Is everyone able to see that? Yes? Perfect. Okay. The ones who are on the screen, I should be able to see see them. All right. Okay. So this was one webinar which I wanted to actually cover for so long. Many of you all, whoever is attending with me for quite some time, all these webinars, I have spoken a lot about the cortisol part before, but today I wanted to get into another layer of understanding your hormones. And the foundation is actually the gut health for this. So, in the 90 minutes that we are going to cover today, I'm going to give you the exact step-by-step things that what's actually going wrong with your gut, which possibly is affecting your hormones. And it is not as simple as, just going on a gluten-free diet. Okay. So let's understand that. Okay. So, three important things that you should expect from this webinar is that number one, that whatever the symptoms that persist, even in your reports, whatever looks normal might not be normal for you because there are better and deeper understanding towards these things, which I will explain you one by one. And I will also uncover the hidden gut-driven triggers, which possibly affects your hormones like PCOS, Hashimoto, infertility, endometriosis, and all of that. And why just, eliminating gluten and dairy is often not enough and what actually is the right strategy to work towards to get the results is what is expected in this entire webinar. Okay. Now, I am a clinical nutritionist actually, and I have been practicing this for almost like 15 to 17 years, you can say, and I have worked with multiple doctors and in hospitals and a lot of clinical practices I have done. And I was working even in ICU level patients, and I have seen critical patients with cancer and diabetes and heart patients, all of that. But when I was working actually in the hospitals, I realized, there were these printed sheets that was given to everyone in that particular, health issue. For example, if it was cancer patient, it was a standard diet. If it was heart patient, it was a standard diet. If it was like, a diabetic patient, it was a standard diet. So I have worked like that in my college. And also when I was practicing with a lot of doctors, I realized it was a standard thing for everyone. So many times, people used to get results, but people used to also not get results. In fact, I used to go in that mode that I am only a problem. Maybe I'm not able to solve patients' issues without understanding that there are much deeper things because the access at that point of time for functional medicine and other things were not easily available in India, especially, and it was just booming in US at that point of time. So while I had so many failures with the patient's results and everything, I realized that it is important now to understand what is actually going on with these kind of patients who are actually not getting the results, whereas others are getting that. So that's when I decided that one of the major mission is that I have to help women find their problems, what exactly is causing this kind of an issue like thyroid, PCOS, insulin resistance with the functional medicine approach, and what kind of advanced testing that possibly is important to understand these things because sometimes generic ones are not giving us the answers. So I will brief you one by one about all of that. So let's learn about the digestion first. Now, before I talk about hormones, I first want you to understand about the digestion. And a lot of us, of course, remember what is the digestive system looks like. So I'm going to go one by one, but at a deeper level. And you please start making notes along with me because I will not move further if you do not understand the basics. It will absolutely make no sense whatever I'll talk ahead. Okay. Now, if you see this, like I said, we have studied this in our school. Okay, so there is this mouth that we have where we chew the food, masticate the food. Okay, there is a saliva. Okay, now these saliva is going to produce amylase, which is going to break down, especially the starch, which is coming from the carbohydrate. It's going to break that down. That forms like a molus, like एक छोटा सा ball जैसा बन जाता है. It forms like that, and then it goes into the stomach through the esophagus. Okay, now this stomach, this here, okay, it has uh, one second, huh? Yeah. Okay. Yeah. So stomach has acidic pH. It is acidic in nature. It has hydrochloric acid. Hydrochloric acid main work is to break down the proteins. It breaks down the protein. Please write this down, everyone. Okay, because only then you will be able to connect your symptoms. Okay, so it has gastric juices. Specifically, it is the acid which is actually breaking down the protein. Then also the pepsin and the other enzymes which comes through the pancreas. Now the pancreas, okay, which is here, okay, it's also going to be releasing certain enzymes which is going to be released in the stomach, and it is also going to help you to break down carbohydrate, proteins, and fats. So acid, enzymes, and then third comes the gallbladder, which has bile in that. Bile helps you to break down. It's like detergent powder. Okay, it आपकी कढ़ाई में if there is fat, what are you going to use? You're going to use detergent powder to buffer that, right? So that buffering is done by bile, which is coming from the gallbladder. It is produced in the liver. It gets stored in the gallbladder, and then it comes into the stomach, and it helps you to break down the fat. So in the stomach level, three things are very important. It's the acid, it's the enzymes, and the bile. Enzymes are coming from, where is it coming from? Enzymes are coming from which organ? Tell me, the digestive enzymes are coming from where? Yes, pancreas. Bile is produced by liver. It gets stored in gallbladder and it comes in the digestive tract. Okay? So two organs involved for bile function, which is liver and gallbladder. Write it down, everyone. Gallbladder and liver, these two things are responsible for that. Okay? Till now, everyone clear till stomach? Three things: acid, enzymes, and bile. I talked about three organs here: liver, gallbladder, pancreas, and of course, stomach, fourth. Okay. Then comes the small intestine. You eat the food, then it goes, repeat about the bile. So, bile is produced in the liver. Okay. It helps you to break down the fats. Whatever fats you eat, it helps you to break down the fats, but the liver produces that and gallbladder stores it. Okay. And whenever it is needed, it dumps into the digestive tract, which is here for digestion. Okay. So it is involved in the digestion process indirectly. I hope you are understanding that. Okay. So this is what it is. Now, after the stomach, may all the process is done, carbohydrate, proteins, and fats, it's broken down well. It becomes like another, it's called chyme, but lekin simply just remember it as like a digest. It's like khichdi. It's like a broken, it's like a mashed khichdi. Think of it like that. Simple, in a simple language. Okay. Then it goes into the small intestine, which is here. In the small intestine, it's like chalni, it's like sieve. Okay. Whatever the juices that has to be absorbed, it gets absorbed into the bloodstream. And then whatever is not needed goes further into the large intestine. Understood? So small intestine absorbs the nutrients into the bloodstream. Everyone understood this? And it is a very sterilized place. It's a very sterilized place. Wahan pe there is no bacteria, there is no fungus, there is nothing there. Okay? It's literally as like the most sterile place. Also tell me one thing. When you have acid, hydrochloric acid, we have studied this in our school, it's a very strong acid. Can anything survive in that, like any kind of a microbe, anything that can survive in that, any kind of bacteria, fungus, anything? So it is a natural antimicrobial also. It will not allow any kind of infection to enter further into the digestive tract. So it is also antimicrobial. So the small intestine is a very sterilized place, of course, thanks to the acids. It's not allowing anything to enter there. So now the small intestine is taking care of all the nutrition. It goes into the bloodstream. And then whatever remains goes into the large intestine. Goes into the large intestine. Large intestine has trillions of bacteria there. Trillions. Okay. It is so much so that it will now start eating that whatever that is left and sent from the small intestine. It's going to eat that up. It's going to produce B complex, digestive, sorry, not digestive enzyme, the essential fatty acids, that it will eat up that fiber and increase its colony there. It will make a nice, beautiful environment of digestion there. Okay. And whatever it is produced there, it's also getting back into the blood. And that left part is now going out as stools. Everyone understood this much? So small intestine, sterilized place. Large intestine has trillions of good bacteria. It has a combination of good and bad both. But of course, it's like a harmonious place where it stays properly. Everyone understood this much? Because it's going to link with other medical issues that you probably might be facing. Okay, what kind of issues you have in these areas? Everyone understood? Please give me a yes in the chat window. Quickly. I want maximum people to answer me. Perfect. Good. Okay. Now, please know this, that on this lining, there is another way to protect anything to enter into the bloodstream. It's a very sophisticated design by nature, you know. So it's protected with 70 to 80% of immune cells on this lining. For example, if something has some kind of bacteria or any kind of infection there, the immune system, which is on the lining, on this line, it's going to enter inside and I mean, anything that is probably entering outside, no, it's going to just fight it inside only. It's not going to allow anything to enter in the bloodstream very easily. Did you understand about the immune system? Yes or no, guys? Did you understand about the immune system? It has immune system around 70 to 80%. We'll talk about SIBO, all of that later. Just understand the basics. Listen to me carefully first. What are the problems? What are the medical issues? We'll talk about that later. Everyone understood about the digestive tract, enzymes, acids, immune system, bacteria kahan hota hai. Everyone understood that. Write to me quickly in the chat. Yes. Okay. So let's move forward. Okay. Let's understand what are the problems, possible problems. Okay. I'll go directly here, not there. In stomach level, everyone, please make a note of this. In stomach level, if the acids are going to be low, okay, now before only you tell me. I'm not sharing the screen, so I want to see how much of brainstorming you can do. If the acids are going to be less in the stomach, what possibly can happen if the acids are going to be less? Immune system is on the gut lining. That's all you need to remember right now. Indigestion, I want very specific thing. What did I say? Acid breaks down proteins. So do you think the protein breakdown is going to be there? It's not going to be there, right? You will not be. So whenever you will eat proteins, what is it that you're going to feel? Indigestion. Indigestion in the sense it's still there in the stomach for a long time. Especially with proteins, you're going to feel like that. Any protein-rich food, yeah, you'll feel bloating. When you have poor enzymes, suppose acids are also there, enzymes. So pancreas are not releasing enough enzymes. Again, the bloating will happen. You're not breaking down carbohydrate, proteins, and fats. You feel that it's staying in the stomach for a long time. Yes or no? You'll feel gassy. You'll feel gassy also, right? Yes or no? Everyone able to use the brain now? What is it going to connect with? Third, if suppose bile is not getting released properly into the stomach, what will happen now? Whenever you're going to eat fats, any kind of fats, okay, even if it is healthy fat, you will feel some kind of a cramp, and then you will rush to the toilet and you will have like a fatty kind of a stool. Fatty stools can happen. You'll feel fatty stool, foul smelling, fatty stools. Diarrhea can also be sometimes there. Constipation can also be there. The stools will be a little less yellow because bile has a yellow color. Okay, so it will be less yellow. You're going to see that. Everyone understood the symptoms? What will it show whenever the fats are going to be less absorbed because of this? So at stomach level, when what should happen? You should have good amount of stomach acids. It helps you to break down the protein. It kills the pathogens. Any kind of bacteria, anything cannot enter in the bloodstream or the next organ easily, right? It absorbs the minerals, especially your iron and B12. Okay, I want to tell a lot of you one thing is that very recently I'm seeing that, there was one patient of mine. She said that I checked my intrinsic factor, which is in the stomach again for B12 absorption only. She said that it was looking absolutely normal, but I'm always deficient in B12. Why is that? It's not just that because she's vegetarian, even after taking the B12 supplements or anything, she's still deficient. Why? Because her stomach acid was low, which allowed the pathogens to survive very easily, and that pathogen was eating up the B12. A lot of time, patients will see they are anemic always. In spite of taking iron supplements, they don't see that their iron is good. Why? It can be number one reason the acids are very low. It's not, you need stomach acid to be proper for your iron absorption. Okay. So if iron is going to be low, obviously your thyroid function will be slow. Your hair fall will definitely be there. You will not see any improvement in your hair. Okay. You will not see any improvement in your ferritin levels when you check your blood test, even after taking your medications or supplementation. In fact, if you have parasites by any chance in your gut, infection, okay, it survives on iron. So in spite of doing everything, if you still see that iron is not improving, one can be thalassemia, then that's a different thing altogether. But if you do not have any such conditions and you still are anemic, then there is a possibility of either H. pylori or H. pylori infection, or it can be also some kind of a parasite which is existing in your gut, which will keep your iron low. And iron low hua to kya hoga? Like I said, thyroid will be slow. Thyroid needs iron. It will slow down the absorption. It will affect your hair, thinning of hair. All those things are going to come from there. Okay, that's how it is connected. Then what happens when your stomach acids are going to be low? Protein digestion will be affected. Mineral absorption, of course, will be very poor, like I said. Any pathogen can survive. Obviously, it is the best scenario. There is no acid. Anything can enter very easily, right? So pathogen can survive very easily, like any kind of parasite, any kind of opportunistic bacteria, H. pylori, a lot of these things are there, which probably you don't need to memorize the names of this, but any kind of bacterial infection, parasitic infection, fungal infection can survive very easily if the stomach acids are low or the enzymes are also low. Okay, so please know this. Foods enter the intestine obviously half digested because now this person is already having a compromised gut in the sense the acids are low, and this little food which is unbroken is now going to the small intestine, is going to give you more bloating and uneasiness, obviously, right? So what are the immediate symptoms that you can see is that when you eat the food, immediately after that you feel bloated, not after 1 hour or 2 hours, because in the stomach once it reaches, it's not able to break down, so you're going to feel like that. You're continuously burping. Acid reflux. One more thing that I have not written here, is that even dry coughing is a sign of low stomach acid, by the way. Not always everyone is going to see, oh, I have acidity kind of that burning sensation. Not everyone has that. Okay, even if you have like a dry cough all the time, it is a sign that you probably have low stomach acids. Okay. And you feel, especially with proteins, you feel like the whole day your stomach is like full. You don't feel hungry at all. Iron absorption will be poor, so iron deficiency anemia. and B12 deficiency can be there. So despite of the supplementation and hormonal issues, what will happen? See, all our hormones, please write down everyone, are made up of main two things. It's the fats and the proteins. So if you're not getting enough proteins breakdown, obviously you will not have a good hormone balance. Definitely not. Iron is very important for thyroid function. Zinc is important for your thyroid and for ovulation. B12 and folic acid, as you know, it is important again for your for your ovulation and for your regulation of the cycles. So if at stomach level, if the things are not going fine, it will affect your hormones, and you are then doing cycle syncing, you are doing exercise, you are taking your proteins, but nothing is helping you. So this is where the deeper analysis comes into picture. Okay, everyone understood about the stomach part till now? Perfect. So if you see this here, this previous slide which I didn't show you guys, this is normal stomach acid. People think acidity means it's more acid. Please don't think like that. 90% of the times it is 90 what 99% of the times it is low acid production. So there is a small muscle here which keeps the food intact here. It does not allow it to come up. Okay, but if the acids are low and this muscle is like very weak, that little acid and that food which is here, it just keeps coming up, and it's just start forming a lot of acid kind of issues for you, and you feel it's more acid, but it's actually less. Now imagine if you are taking an antacid which is suppressing that little acid also. So you feel temporarily good, but eventually it's making it worse, and you have achlorhydria where there is no acid at all. Now, ऐसे case में what will happen is this lining now, this lining, which is a very smooth lining inside the stomach, it starts getting affected because the infection can, start eating up this lining, and then it starts forming gastritis, and then it starts giving you ulcers. So that's a very extreme stage of low stomach acid. Okay. So don't think that if I have acid issues, then it is like, oh, it is more acid. It is not true in most of the cases. Okay. Pancreas, like I said, what does it do? It releases enzymes. It is important to break down the carbohydrate, proteins, and fats. So if your enzymes are going to be also poor, if your acids are good, but if your enzymes are not getting released, you will still have the bloating issues. Okay, so I generally check for amylase and lipase in the blood test for my patients. Sometimes it shows like low. I put them on digestive enzymes to support, but sometimes it does not. But the patient has symptoms of things. So symptomatically, also, if it is there, then I put them on digestive enzymes. Okay. Because amylase and lipase sometimes are not sensitive enough to come into the blood report, honestly speaking. So there are advanced testings like which I'm going to discuss today. But like I said, the if you are having bloating issues or anything like that, digestive enzyme can probably support, or digestive bitters can definitely support you to balance your bloating and gas issues at the stomach level. Okay, so the food stays undigested, fermentation happens, and then you feel gassy all day. And bacteria feeds on this leftover food, and it gives gas, bloating, discomfort increases a lot. Okay, and then obviously because pancreas will also release your insulin. So if your pancreas are not working fine, okay, and it is overworking because of insulin resistance, it will demand more insulin to spike. Okay, if there's more pressure on the pancreas. And in fact, somebody who's having type 1 diabetes, who is insulin dependent, they always need enzymes to be supported because the pancreas are totally damaged. So they need a digestion support also because they are releasing even digestive enzymes, not just insulin. So insulin demand increases, insulin resistance gets affected. Obviously, when you have insulin resistance, what will happen? Obviously, ovulation will be affected, androgen will be high, all of these kind of issues. So it's not like I said, it's as simple as just you have insulin resistance, take ovacetol and you're good to go. Okay, so even checking your digestion at even pancreatic level is also very, very important. Did I make sense? I hope I'm trying to simplify things for all of you guys. And I think everyone is on Instagram and Chat GPT these days, so they all know a lot of things, the technical parts. So I think it should make sense to people. Okay, so before I talk about bile. Okay. I want to tell you guys why do I keep saying about one thing is that okay, is my voice breaking, guys? Am I clear? Am I clear? Okay. If something happens, just let me know in the chat. Okay. Yeah. All right. So j before I talk about fats, please, the bile, why the fats are so important for your hormones. Let's understand that. Okay. This is complicated. Please don't get into that. Let's simplify it. Simple way, may I will try to make you understand. Can you see this cholesterol written here? What is cholesterol? Cholesterol is fats. What did I say? Our hormones are made up of fats and proteins. Our sex hormone is made up of fats, especially. Okay, let's see how. Cholesterol. इसके पहले एक और चीज डाल दो, vitamin D. Vitamin D is the precursor to balance your cholesterol. So अगर आप deficient होगे vitamin D में, cholesterol formation will never be good. Remember this. The people who are taking D3 very casually, please don't do that. Bring it up in your blood levels if you have hormone issues, because this is where the cholesterol formation will improve and improve your hormones. So that is why you will see everywhere vitamin D very important for PCOS. Why? For this reason. Okay, because it balances your hormones. So vitamin D, precursor of cholesterol. Cholesterol, can you see go down? See, what is it? Progesterone. Can you see progesterone here? Do you guys understand? Progesterone is also, two hormones are important for your ovulation and other things. Like I said, of course, there are many, but main everyone talks about is estrogen and progesterone. So the cholesterol is what is going to make your progesterone. So if you're not eating enough fats, or if your body is not breaking down enough fats properly, don't you think your progesterone will be affected? What did I say? Bile breaks down fats. Our hormones are made up of fats. If your bile is not there enough to break down the fats, hormones will not form. It's the same thing I'm talking about. So if you do not have bile, suppose cholesterol is not metabolizing properly, it will not give enough of cholesterol to form the progesterone. Now, second pathway पे आ जाओ यहाँ पे. Can you see this cortisol, stress hormone? If this is going to be high, this cholesterol will not choose to make progesterone, but to make the cortisol. This pathway will shift from here to here. Again, you will be deficient in progesterone. That is why I spoke so much about emotional well-being in the last 2 months. Okay. Then further down, go here, DHEA, testosterone. See, testosterone is also so important. But this needs to be converted into estrogen. Can you see this? So it is all interlinked here. If you do not, so let's go here. If bile is not functioning properly, it will give you problems of digesting fats. So what does the bile do? Which is coming from? Which place the bile is coming from? Bile is produced? Bile is produced where? It is produced by liver, not pancreas. Yes. And where does it get stored? Where does it get stored? Gallbladder. Yes. This gallbladder will use the bile and put it into the digestive tract to break down the fats. Okay, perfect. Now I think everyone is understanding, so I'm happy. Okay, so it will break down the fats. Now there are fat soluble vitamins A, D, E, K. Now tell me, if you are not able to break down fats, and vitamin D is a fat soluble vitamin, you keep trying your vitamin D levels, and then you will come up with the same problem that, oh, my vitamin D keeps coming down. बहुत easily कम हो जाता है. That means you are actually not breaking down the fats, or you are not eating enough fats. Does it make sense? Is this a bulb-on thing for you guys? कुछ समझ में आया? Interconnection. So it's important for us to have that bile clear. Okay, it also eliminates the estrogen out through stool. See, please understand. Everyone Okay, could you please repeat? What do you want me to repeat? Uh, so there is liver, which makes the bile. It stores in the gallbladder, goes into the digestive tract. आपने फैट्स खाया, बाइल क्या करेगा? उसको ब्रेक डाउन करेगा. बाइल नहीं होगा तो ब्रेक डाउन नहीं होगा. ऐसे कैसे fats will go out in the stools. When you are going to be deficient in fat, you are not going to get fat soluble vitamins also, because उसके लिए fat जरूरी है. A, D, E, K. So your fats will absorb these nutrients and put it inside the bloodstream, but it is not getting absorbed now. So it's going out in the stool. So you are going to be deficient in vitamins also. Simple as that. Okay. Now, everyone knows about estrogen, progesterone. First half of the cycle, we have estrogen. Second half of the cycle, we have progesterone, right? Does everyone know this, that if estrogen is going to be high, progesterone does not rise? Everyone knows this or not? Tell me honestly. I'll explain a very small bit of it. Yes or no? No? Okay. Let me understand, make you guys understand. Please listen to me very carefully, okay, before I move ahead. See, we have 2 period cycles. उसके बीच में 1 month है. So you had the last day of your periods today, for example, and then you will get the periods the next month, right? So in between that 1 month of 28 days to 30 days, body will obviously have to make a new egg for ovulation. अब pregnant नहीं हुए तो periods होगा ना? That is the whole month's process, right? So the first half of the cycle, that means the first 14 days, the body is preparing for the egg to form. Okay, release actually. Okay, this releasing part, the ovulation part, entire thing happens through estrogen. Okay, then the estrogen ka kaam is done. Then the next hormone, that is the progesterone. Ovulation ho gaya na, to estrogen ka kaam ho gaya. Then the next hormone comes, which is the progesterone. What will the progesterone do? Suppose there is a baby now that is formed on the ovulation day. Okay, अभी बेबी के लिए एक यूट्रस में बेड तो बनाना पड़ेगा ना, एक छोटा सा बेड बनाना पड़ेगा. तो वो बेड बनाने का काम कौन करता है? प्रोजेस्टेरॉन करता है. इट फॉर्म्स द यूट्रिन लाइनिंग. बट फॉर एग्जांपल, if the baby is not formed, what is the use of this bed? What is the use of this bed? No use. So it will shed into periods. Everyone understood this? I've simplified it. Estrogen, progesterone. Okay. Now, if your now estrogen gets eliminated out through stools, through sweat, through stools, and through sweat. Okay, primarily your stools. Okay. Now tell me, if you have constipation, can you eliminate estrogen properly? Of course, no. Of course, no. Okay. So elimination of estrogen does not happen properly if your bile is going to be poor. Please know this fact. अब estrogen अगर elimination नहीं होगा, it will go back into the blood. Okay, it will go back into the blood. Estrogen अभी हाई होते जा रहा है ब्लड स्ट्रीम में, फॉर एग्जाम्पल. नेक्स्ट, एक्चुअली वो हाई नहीं हो रहा है, वो जा रहा है. नेक्स्ट साइकिल आपका वापस से ईस्ट्रोजन बना रहा है, वो वापस से ब्लड में वापस जा रहा है. नेक्स्ट साइकिल फिर से वो बना रहा है ईस्ट्रोजन. तो बॉडी बनाते जा रही है ईस्ट्रोजन, और वो वापस आते भी जा रहा है, एलिमिनेट ही नहीं हो रहा है. तो ईस्ट्रोजन बिकम्स रियली हाई. नाउ व्हेन द ईस्ट्रोजन डज नॉट ड्रॉप, द प्रोजेस्ट्रॉन का नीड डज नॉट कम टू राइज. प्लीज नो दिस फैक्ट. द प्रोजेस्ट्रॉन विल नॉट राइज. जब ईस्ट्रोजन कम होगा तभी ही प्रोजेस्टेरॉन राइज होगा. प्लीज नो दैट. दिस इज अ कंडीशन कॉल्ड एज ईस्ट्रोजन डोमिनेंस. सम ऑफ द पेशेंट्स डू नॉट हैव ईस्ट्रोजन डोमिनेंस, बट प्रोजेस्टेरॉन ही नेचुरली कम होता है. जैसे मैंने आपको बताया, अगर स्ट्रेस ज्यादा है तो प्रोजेस्टेरॉन कम बनेगा. दैट इज ऑल्सो कंडीशन ऑफ ईस्ट्रोजन डोमिनेंस ओनली. तो अगर ईस्ट्रोजन हाई होगा, you are going to have PCOS issues, you are going to have thyroid issues. It is also coming back from your digestion. So if you do not have enough bile to break down fats, estrogen का elimination नहीं होगा, which will eventually make you estrogen dominant and make you a PCOS patient or a thyroid patient. So it is again coming back to your digestion only. I hope I could make sense to everyone. Yeah. Everyone understood? Good. So Constipation, very bad if you have like, so if you have constipation, I mean, today only actually I was talking to one of my patients from US. She whenever she takes iron supplements, she used to be constipated. That means her body is not breaking down iron well. I had to put her on a digestive enzyme. I supported her digestion, gave her a protocol to keep some gap between the meals and work it out. Today, she said in the call that I have negligible constipation with the same supplement. So, people who say that I have constipation with iron supplements and I give a very gentle form, still, if they have, that means you're not breaking down the food well. Okay, it's a sign of that. So constipation will happen, estrogen will go back into the blood. PMS, yes, you're going to have PMS issues because it's again coming from estrogen dominance. Painful heavy periods will come. Obviously, estrogen is making you worse. Acne will come back. Okay, and then you will see struggles with weight. Okay. So estrogen dominance, progesterone will suppress, and irregular cycles and PCOS symptoms will intensify if the bile is not working fine. This is the repercussion of that. Everyone understood till now? Whatever I have explained? I feel so much bloated. Yeah, possibly you have low stomach acid, enzymes, whatsoever. We have to take bile salts if the bile is affected. First is to cleanse the liver. First is to stomach, पहले तो stomach acid को मैं बताऊंगी वो सारा in the end, don't worry. But you have to support your entire digestion for the bile. Okay. And if the suppose gallbladder is not there, तब तो bile salts का supplement you have to take lifelong, like lifelong. But if it is sluggish, it is overworking, and suppose you have gallstones also, you can just take bile salts. But it's a non-veg product, so not everyone is comfortable. Okay. Now, did I make sense? So I'll tell you about the solutions and everything in the end, but I just hope that everyone is understanding about the basics of what I'm trying to make you guys understand. Like, are you able to relate to the symptoms and the gut issues, what's going on possibly? Right? Okay. Let's go to the next one. Uh, small intestine. Now, can you see inside? This is the inside look of that. It looks like a carpet. It looks like a carpet. Okay. And it's literally like this villi here, beautiful thing. It protects anything to enter into the bloodstream. So this is the inside and this is the outside. समझो यहाँ पे blood है हमारा, bloodstream है. Okay. And this is the inside. This is the inside part. ये है ना? This is the inside part. Okay. So यहाँ पे anything, it's a beautiful layer or mucosal healthy layer. Okay, it keeps anything away to enter here. And can you see this tight junctions here? यहाँ पे tight ये junctions है, एकदम tight रहता है. It's like very tight. It does not allow anything to enter in the bloodstream. Okay, this is the bloodstream. So here is the immune system. Okay, so anything that could possibly enter, I will show you the next picture how it works. So it's very difficult to enter here. Okay, this is the epithelial wall. See, if there is a damage to your, mucosal layer here, if it is poor, and this will start getting affected. And now this damage can come easily. Then comes, this breaking of these junctions. Can you see everything is entering here? Boom. Now the the entire immune system, which was actually going to fight inside, is now going in the bloodstream and fighting. Okay, this is what happens. This is what is called commonly leaky gut issue. Okay, so what happens with leaky gut? What are the repercussions of that? Let's see that. Now, did I tell you that in the initial starting of this webinar, what did I say? It's a very sterilized place. There is no infection or anything here. If the mucosal line is affected, if there is this epithelial wall is affected and there are breaking of this, the infection can persist here very easily. This is what is called as SIBO, C4, whatever is the infection that is persisting. If it is bacterial overgrowth, it can be that. If it is fungal overgrowth, it can be that. So such patients are going to have, bloating after 1 or 2 hours of the meal. They will be like, हम खाना खाते हैं. By the end of the day, I have swelling in my belly. They will come up with such kind of symptoms. It's not going to be immediate. Okay, so it's a sign that there is a possibility of SIBO or C4. Okay, now when the leaks happens like these and it enters, Okay, the immune system is now getting hyper. Now, anything which is triggering the immune system is also going to give you autoimmune kind of issues. So even in thyroid patients who have antibodies high, they definitely have some kind of a leaky gut issue. Some kind of infection probably is there, which is now entering the bloodstream and triggering your immune system. So let's see how. Okay. So when the digestion upstream is weak, that means the mucosal lining and the epithelial wall. So undigested food can enter in the small intestine. Bacteria grows where they shouldn't be growing, actually, which is in the large intestine. That it starts growing in the wrong place, even if it is a healthy bacteria. Okay, pathogens can survive very easily, any kind of infection. Okay, you will have bloating issues after 1 or 2 hours of the meals. You'll have gas, and you'll come up with food intolerance. Like, I used to eat that food before, but suddenly it is not suiting me. I'm one of the living examples of that. Okay, so I had this same issue. One trigger, second trigger, third trigger. The patient would be like, "पहले मुझे ये सूट नहीं करता था, अभी मुझे ये भी सूट नहीं करता है." The third, then the fourth, because the leakage is the damage is more. Now, a lot of things are entering, which is why so many food sensitivities and intolerances are coming up. It's not allergy; it is food sensitivity or food intolerance, which is coming now into the picture. Okay, and it can give you delayed kind of reactions. It's not necessary that you eat something and then you immediately get a reaction, because that generally happens with allergy issues. Food sensitivities and intolerances generally comes up when there is a leaky gut issue, and when there is infection which is persisting and making your immune system hyper. Okay, recurring infection keeps coming back, and like I said, for infections, it is not necessary that you're going to have some kind of a problem. Like, some diarrhea is there, loose motion is there. Not necessary. These pathogens are very clever. It can just hide themselves inside and stay there always. And it's just going to give you food related issues or some mild kind of symptoms. Okay. And maybe thyroid is affected, insulin resistance is there, but we'll not even come to know if there is something related to your gut, in fact, because the patient will be like, I didn't have any digestion issues, but I just have insulin resistance. But when they keep trying, they don't see improvement in insulin or anything like that. Are you getting it? And then food sensitivities comes eventually as an issue for them. So chronic inflammation, of course, inflammation is going to be more when such things happen. Inflammation is more, the body is always in alert and fighting mode, which is why the inflammation will be there. Of course, there is a stressful environment in the gut. So obviously your cortisol will remain elevated. So it's not always about that I have to have problem in life to have my cortisol high, but even this is a stressor for the body. Are you getting it? So thyroid conversion will be very poor. See, thyroid gets converted into the gut. So if you have leaky gut issues, if you have poor digestion, thyroid is the first thing that gets affected. Okay. Ovulation, of course, will be suppressed. Did you understand about the small intestine? Yes, yes. Yeah, the ama you're talking about is actually the infection only in the Ayurvedic language. Yes, it comes through that. So it is again coming from the starting thing only, like the acids are low or enzymatic function is poor, So ama is that, yes. So, but forming the gut lining, yes. Thyroid antibodies, we'll talk about that. Don't worry about it. Let's understand the basics, that what exactly is causing these issues. I want you all to understand that, and then we'll go to in the detail of, what are the things that you're supposed to do. Okay. I hope I could make sense till the small intestine. Did you guys understand about the leaky gut, how it happens, any test for acid? Stomach acid cut testing part, I will tell again. What is the reason behind fibroid is also estrogen dominance issue. Is also an estrogen dominance issue. Yes. Okay. So leaky gut, like I said, the gut lining is affected. Toxins can enter in the bloodstream. Immune system will become trigger here. Chronic inflammation and hormonal resistance, autoimmune activation. Antibodies will rise in the blood report, Hashimoto. Medication response will be very weak. Okay. Now come to the large intestine part here. So what should happen? Now, balanced gut bacteria should be there. Okay, proper stool formation has to be there, and detoxification of all the hormones happens here. That's so important. When the microbiome is out of balance, it can be possible that the good bacteria which is there can be overgrown. Anything which is overgrown is also a problem. Too much of anything is bad. Okay. So even if it is a good bacteria, if it is overgrown, and in the overgrown is generally seen with patients with constipation, chronic inflammation, such patients will come up with higher levels of, good commensal bacteria. So sometimes if it is too low, then the body is like not responsive at all. Like it will affect the gut lining and form leaky gut and other issues. Okay. So harmful bacteria can dominate there very easily. Inflammation will increase, constipation or loose stool, anything can appear here in the large intestine because this is where the stool formation happens. Okay. Now, hormonal consequences, of course, like I said, estrogen will get reabsorbed. You will have estrogen dominance issues. Androgens increases because of this. PCOS, of course, will become worse and insulin sensitivity drops. Okay. These are the repercussions if your large intestine is not working. So, if you have PCOS and you have constipation, and then you are trying to take only myo-inositol and just, low carb kind of a diet and doing weight training, it will not help you because you are not working on, you know, that thing which is actually bringing back the estrogen back into the blood. So there is no point of just, taking a myo-inositol in that case. You have to first fix that gut, which is actually reversing back that estrogen back into the blood. Only then the person will not come back with the same kind of a problem. Okay. Otherwise, these people will see improvement and then you will come back to the same. Okay. This is called relapse, nothing else. So in PCOS, if you have gut inflammation, it will affect your insulin resistance. Insulin resistance will have androgen excess, poor estrogen clearance, will have cycle irregularity, microbiome imbalance, and weight and acne issues will start coming in. And insulin resistance, if it is there, then it's just going to be poor digestion, glucose spikes, and chronic inflammation, insulin signaling failure, and gut bacteria imbalance. Of course, fat storage will increase with that. There are certain bacteria even in the gut which we can see, which is probably not helping you to lose weight at all, actually. Okay. So there are some bacteria which are going to be making you stubborn, absolutely stubborn in the weight. Then comes the thyroid, of course. Like I said, if the poor nutrition is there, absorption is poor, like in the sense, your iron, B12, zinc, obviously thyroid function will be affected because of that inflammation. Because, like I said, activation happens in the gut. So if the gut is inflamed and there is problem there, the T4 to T3 conversion will not happen. Leaky gut will increase your antibodies. Keep trying a gluten-free diet, dairy-free diet, but you're not sealing the gut lining, not improving the gut lining, the mucosal layer, you're not fixing, and you're not, improving your immune function, which is exhausted. There's no way that you will see improvement in your thyroid with this. Okay. So you will keep doing gluten-free, dairy-free, and still see that your antibodies, which because it has happened with a lot of my patients, I was like always confused that why it is not improving. And then when I realized that, oh my God, there are many layers to it. Okay. So this could be one of the reasons for it. So infertility, chronic inflammation suppresses ovulation, obviously. Poor progesterone production will be there, hormone signaling disruption will be there, body stays in unsafe mode, cortisol can be high. So, in fact, I'm getting a few patients now who are under IVF treatments, and I see a pattern there also that, majority of them have uh, antibodies high and thyroid issues. And the doctors are like, everything is normal, everything is normal, everything is normal. But when I see their antibodies, sometimes it's the antibodies which does not allow the implantation to happen. See, I'm not a doctor here to claim anything to anyone, but at least balance your and support your hormones, especially when your immune system when it comes to that, because that also helps in improving the fertility rate. Okay. Not just the medication alone. So support is very important. So why gluten-free and dairy-free alone does not work? Like I said, just removing the trigger will just lower the irritation temporarily, but it does not, you are not fixing your stomach acid. You're not improving your bile flow, for example. The enzymes are like insufficient. Bacterial overgrowth, a pathogen is there. Leaky gut is there. So you're not fixing these things, but you're eliminating. You're just doing a sugar-free diet, dairy-free, this, that. What's the point? Do the work there also and do this, then it makes sense. You will find some improvement and not going back to the relapse again and again. Okay, so It's not that the blood tests are bad. I'm not saying that. I have like spoken a lot about functional labs, and we do that as the first protocol for any of our patients. In fact, blood test is important because it gives us a generic idea, and a lot of testings are needed even for your vitamins and everything through your blood test only, which other advanced tests can't do. So that is definitely there. But if you're having so many issues, then you need to go to the advanced level. So sometimes it's not enough for us to understand that. So let's see why. So why what the blood test can actually show is that what are the severe deficiencies? What are the advanced thyroid dysfunctions? Of course, like you have T3, T-catenin, T4, T-catenin, TSH, antibodies high actinium. Of course, you need that blood work for that. You need to understand if your insulin is very high through blood work, inflammatory markers if it is very high. Yes, so it is important to do the blood work. But what it cannot show, unfortunately, is that how much are you breaking down the food? Are you absorbing the nutrients or not? Is your gut microbiome good or not? If there is any pathogen which is there, parasite, endotoxins, like endotoxins are there, which are produced and causing issues. And is your estrogen going back into the blood because of certain, LPS or anything like that? If your cortisol is imbalanced, you can't really come to know through the basic testings. The blood work is not very sophisticated test to actually understand. So you will see that in spite of you doing everything, everything is looking still normal, but you still have the symptoms which are persisting, and the supplements don't work, and the hormones are not stabilizing. So it can show like a false normal problem. Many people hear like, the normal, it's a normal report, but they will still experience bloating, PMS. In fact, a lot of patients I've also seen that they say that I had bloating issues, but now it's not there. So I'm doing this diet, it's improving, but I don't see any improvement. And then suddenly they eat something else, and then they get back the bloating problem. That means it was still not breaking down. You just, did not give any kind of a relapse. So very recently, I had a patient who had the same issue. Like, she was somewhere else and she had to eat like a fatty food. And I was very grateful for that, because when she had a fried food, she had like a solid stomach upset. And she said, I cannot tolerate something like this. So I understood immediately. And she was trying for, conception. So I immediately realized that even if you do not have bloating, but I think your body is not breaking down fats. So I had to support her bile so that she can have enough fats breakdown, and then she can improve her hormones. Okay. So sometimes the symptoms are also not showing you clearly what's going on. So it's not necessary that everybody is going to have bloating issues. So bloating, PMS, irregular cycles, hair fall, fatigue, these kind of symptoms still persist, and the person is like, I don't know what's going wrong with me. Now, in such cases, then you need definitely advanced testings. So when advanced testings becomes necessary, so if like I said, like, in such cases, you will need that. So I will show you some of the tests that I currently do for my patients. I'll just show you a bit of it um, as a sample, why it's needed, how it's needed, by the way. But I will also tell you what kind of solutions you need. Like I said, connect your symptoms with whatever I spoke today. And whatever solutions that I'm going to tell you guys today, start doing those things at least. I'm not saying that directly jump into the advanced testings. I'm giving you this knowledge so that you people understand why do we do such things. Okay. So just give me a minute. I'll share my screen. This, I'm pretty sure you guys must have seen somewhere on social media also. This is called GI map test. This is a test which can clearly tell us about, this is a, by the way, very advanced. It's a stool test. It's not like a regular stool test. It uses a very high technology, like a DNA PCR technology, which is very, very sensitive. And it can actually find a lot of things in detail, which a regular stool test cannot. Okay, so you can come to know any kind of pathogens which are there. Now, these are very chronic ones. In such cases, you need doctors' help. You need medications in such cases. This is what I was talking about. So this is about H. pylori, which is in the stomach. If it is persisting, sometimes it gives false report in the regular stool test and even in the breath test. Sometimes it is not very clear if you really have this, and the patient is coming up with gastric issues. So sometimes I'm questioning if this person really have H. pylori or not, because it stays in the mucosal layer, not in the acidic environment. So sometimes it gives us false report. So this is a very sensitive test to actually understand about H. pylori. This is the commensal bacteria, which I was talking about, the large intestine, all the good bacteria, bad bacteria. If it is too high or too low, we can come to know through this. If it is too low, that means you need those probiotics support. Okay. And what kind of probiotics is all dependent on that. But if it's just too high and you take probiotics, oh my God, you're going to have worse symptoms. Okay. So don't jump into probiotics directly, please, without understanding. And if you have SIBO and you take probiotics, then worse, like you're making the bacteria grow into the wrong place, even more worse for you. The only two strains that you can take if you have SIBO is Saccharomyces boulardii, or the second is the spore form of any probiotic you can take. But please consult your doctor. But yes, S. boulardii is something that you can safely take for if you have SIBO or SIFO also. Okay, but don't take anything else apart from that. Okay. This is the opportunistic bacteria. This is the fungal infection. If in case that is there, you can see that also. The best thing that I actually like here is this. Of course, even this parasite. Okay, a lot of people who have like thyroid issues, they can see this parasite as high. There are, like I said, a lot of people who are anemic, and they don't know what is the reason for it. Sometimes, it can show this as a positive for them. The parasite can show positive because it persists, it loves iron, it survives on iron. So this can show as positive for many of the patients. Okay. This is what is going to help us understand if the food is broken down or not. So steatocrit is basically if you are breaking down the fats properly or not. If it is too low, matlab aap nahi kar rahe ho breakdown अच्छे से. If it is too high, you're not breaking down. So you come to know through that. Generally, people who are not able to break down, sorry, is going to be high. It's going to be high. Okay. Elastase is a enzyme. It's also an enzyme. It survives in the gut very easily. That is why they do this, not amylase, lipase, or any other. Okay, so it survives. So if it is too low, that means आपका नहीं बन रहा है सही से enzyme. So you will have problems in breaking down the food. This beta glucuronidase is something which helps us to understand if the estrogen is going back into the blood. Okay, this can clearly say us that if the patient has estrogen dominance because of the gut health. Okay, because of the gut health. So this, and generally it is actually because of the gut health only, but you will see this as a pattern. Occult blood is basically any blood in the stools. That's a different thing. Secretory IgA is mainly your immune response. In this, if it is too low, that means you have exhausted your immune system. It's literally exhausted. And if it is too high, that means it's hyper stimulated, and you are now, your body is just fighting. And such patients will have autoimmune conditions, multiple autoimmune conditions. Okay. And if it is too exhausted, this person is not able to cope up. Their immune system is very weak. Like it's not able to fight back anything. So it all shows that. Gliadin shows about the gluten sensitivity, not allergy, but sensitivity. Calprotectin can show us about the inflammation, and this zonulin is a thing which actually tells us about the leaky gut part, if you really have leaky gut or not. So this is why this is a very important thing in a lot of cases. So I tell a lot of my patients to do this test. And this is about the resistance. Like if you're suppose having H. pylori and you're taking some medicine by the doctor, but if that medicine is resistant for you, it's not working out. So we can come to know about that also in this test. Okay, so that's why it's a very sophisticated test to understand deeper things. And then is, I have spoken a lot about this test, which I have shown my report to everyone. This is Dutch work. Sometimes the hormones does not show like, abnormality in the regular blood work. So in fact, I did this for this reason also. So my estrogen, I had scanty period issue and everything was looking normal to me. So I realized that my cortisol was very high. So generally in the blood test, when you do normal blood test, you will see that they are just doing morning and evening. So if I would have checked that, see, my morning is normal, my evening is normal, but my mid morning was very high and my night was very high. So it's again a very good test to understand. And it is a urine test, which I did. So there is a saliva and urine, which is more sensitive metabolite test than the blood test. So sometimes it can show normal, everything is normal, cortisol is normal, but it's not probably. Okay, so we come to know a lot of things in this kind of a report. Even in the second level, what's going on, these hormones are converted properly also or not. Everything we come to know. Why the androgens are high. Is the estrogen eliminating through the right pathway also or not? In fact, we can also understand from this if the person can have cancer in the future. because of estrogen dominance. We can come to know that also if it is choosing this red pathway more, these patients are more prone to genetic issues of estrogen dominance kind of cancers. So you can protect the patient through that. And of course, cortisol and melatonin and everything we come to know here. So sometimes these kind of, advanced testings are needed by the patients to be done to understand what exactly is going on. Okay. Coming back to the slides. So advanced testings where I need to understand for my some of my patients, like, if the digestion quality is good or not, inflammatory markers are good or not, pathogenic bacteria in any form is there or not. I have to work on killing and removing those infections with the doctor or not. That comes into picture. If the immune system needs to be worked and balanced, in what way? Is it exhausted? Is it too hyper? I cannot work the same way for that patient. Okay. Why the bloating is still persisting? All these things, we come to know through these advanced testings only then. Sometimes the hormones are not functioning properly in spite of like everything looking proper in the blood work sometimes. Then I do tell them to do a Dutch work at that point of time. If it is like I had one patient, she was, good in progesterone in her Dutch test, but in the blood test, it was showing low. So I was confused what's going on. I saw in the advanced test that she is producing enough progesterone, but it is going in another pathway. It is not getting used by the uterus. It's getting used by her brain to balance her cortisol. That was happening. So when I checked that, I realized, oh my God, this girl needs to work on her exhaustion more than anything else. So I put her on that kind of a protocol for, stress management and supporting her immune system. That's how I worked on. Okay, so that's what you come to know. So why one approach does not work for everyone? So this is the main reason for it, because suppose if two people have PCOS, one can have insulin resistance, one can have gut inflammation, one can have cortisol issue, one can have estrogen dominance issue. So it can't be a same protocol for everyone, Yeah, but one thing is that you can work at the beginner level to understand what things are working for you. But if things are not working, that's why I have, like, if you go on my website, I have these three bundles, like, PCOS, thyroid. So you will be like, oh, Shikha has these bundles. And then on the other hand, she's talking about that. Because at the beginning level, you can work on that. Okay. If things are not at all improving for you, that means you then need to go further down and stop doing this experimenting on things. Are you getting it? So you can start with the beginning things and then eventually move towards these things. Okay. So that's how the things can be. So what actually needs to be done? Improve your digestion, improve your inflammation, support your detoxification, improve your gut microbiome, and immune function has to be correct, and nutrition absorption has to be this. Now, how do we work on that? The question for everyone. For stomach acids to improve, okay, if you have, like I said, all the symptoms, whatever I said to you, connect it with your symptoms and start doing these things, whatever I'm telling you today. Okay. If you have stomach acid issues, or even if you do not have, even if you take, digestive bitter to support it, and chewing also, if you do well, like that basic chewing is so important. It will not put pressure on the second organ, the next organ. Okay. So do chew that, have apple cider vinegar or lemon water or digestive bitters to balance your stomach acids. If you think you're having too much bloating issues, speak with your physician or like your nutritionist, start taking digestive enzyme or simply the bitters to support your digestion. Make it a point that you're keeping some gap between your meals, especially if you have constipation issues. Do not keep snacking. Keep a good gap of 3 to 4 hours between two meals without fail. It gives a lot of time for the digestion to move further. Okay, so do that without fail. This is the first thing that you will do, even if the bile is affected for you or not. Now, second, if you think bile is affected for you, that means you feel that you have fatty kind of stools. The minute you eat fried food, you feel bloated. Or do you think that, you have like floating kind of stools? It always floats and it's plop and it's light color, it's pale. That means you have bile flow issues. If that is the case, You can start having beetroot just before your meals to begin with, because I don't want to give you bile salts directly on the webinar like that without me knowing you, obviously. So you can start having grated beetroot before your meals. It helps you to improve your bile. If your gallbladder is removed, please start taking bile salts. It will certainly help you. It will help you, okay, with your meals. Okay. But you can begin with apple cider vinegar or digestive bitters or digestive enzymes. Eat slowly, keep some gap, and then see if you need the bile salts. If your gallbladder is removed, you need to take it. But if it is not, then you first work on these things, then move and see if you still are bloated or not. Only then you start with any kind of bile salts. Especially what you can do is you can eat some kind of a fried kind of a food and see if you are feeling bloated even after taking that. Okay. Like even after taking your digestive enzymes and apple cider vinegar, after chewing food and keeping some gaps, you're still feeling that or not. That means surely you're not breaking down fats. Okay. Then comes the bile support, that is the bile salts. Okay. But you can begin with beetroot, it works well. Okay. Not everyone needs bile salts. Okay. If you have bloating issues, have lighter meals, well cooked meals, no salads, avoid fermented foods, because anything that can ferment inside is going to give you more bloating and obviously gas producing foods, right? So avoid instant snacking also. Keep some gap, like I said. Not like 6 hours, 7 hours. Intermittent fasting bhi mat karo. I'm not talking about intermittent fasting here. Please don't do that. If you have compromised gut, everything is not intermittent fasting. Please wait for it. Keep a gap of 3 to 4 hours. Give some time for your body to break down the food, please. Okay. This is the foundation. If you do this right, I'm telling you 50% of your problem will solve there only. You don't need multiple things. These are the basic things which people fail to do. Basic things. And then they want to buy the whole lot of, supplements. Don't do that mistake, please. Okay. So do this. Then comes your, other things. Now, in this, definitely you need a nutritionist to work with you. Definitely you need somebody to help you guide through. But if anybody of any of my patients who have infections, okay, by any chance, if I see they have autoimmune condition, okay, even if they have not done the advanced testing, but आपका autoimmune conditions hai, you have your antibodies are high, that means you have leaky gut issues. Obviously, I start working on their gut lining first without working on, removing the infection out of their system. Why? Because if I start working immediately on working on improving the, the infection has to go out, this person will not be able to tolerate it at all. Absolutely not. They will have severe symptoms. They will feel like I cannot tolerate it. They will have the same issues which they had before. Okay. So first thing is to, like I said, like the digestion has to improve, acids, digestive enzymes, and the bile. That's the first step, foundation of everything. The second step, and it's a natural antimicrobial. Like I said, if your acids are good, it's natural antimicrobial. So obviously, it is going to help you to, downstream your bacterial overgrowth, right? So gut repair. Now the lining also has to be repaired here. So if any of you who has leaky gut issues, especially you have autoimmune conditions like psoriasis, eczema, skin issues, and thyroid, whatsoever, start working on the gut lining. Second step. Now, I'm not going to tell you to directly start taking supplement. Don't do that mistake. But at least start taking the aloe vera juice. Okay, that works very well. Begin with that. Okay, B complex, omega-3 rich foods. Start including these things because that also helps you to repair the gut lining. Okay, there is something called as glutamine. You can take collagen, you can take bone broth. That also works as a food source to improve that lining. What does collagen do? It forms fine lines ko kam karta hai. So basically it is connecting the tissues. Okay, so that is why it is important for you to take collagen. If you are interested in taking collagen for this reason, you're good to go, not just for your skin. Okay. Internally also it works very well. So you can start with that. Don't directly jump into glutamine and zinc and other things without recommendation. You can start with these foods, aloe vera, collagen and bone broth. Start doing these things. I think most of you, if you are from India, probably You cannot find bone broth very easily here, but I think collagen you should be, yes, collagen is definitely available, so you can go ahead with that. I know it's a non-veg product. Please don't take vegetarian. Vegetarian se kuch nahi hone wala hai. You'll not see improvements. Okay, I'm being honest here. So please make it a point that if you're taking collagen, it has to be the proper marine or the bovine source only. Okay, and omega 3 and B complex is what is important. Now, probiotic I have written here, but I don't want any of you to just start taking probiotics on your own without knowing. Don't do that mistake. Please don't do that mistake. If you don't know if you have SIBO, if you don't know you have gut issues, what kind of issues, if it is overgrown, low, don't do that mistake, please. And secondly, if you feel bloated very easily with fermented foods, then the fermented vegetables or anything is also going to give you bloating issues. Okay, so don't get into the probiotics and prebiotics directly without understanding, because this is the first two steps which is needed. Then in the end, I start working on the pre and the probiotics for any of the patients. I don't want to. I have seen patients going like crazy over it, like they get suddenly super constipated. So don't do that mistake, please. Don't do it on your own. I'm just giving you this as a knowledge, okay? Because it's a very generic recommendation. That is why. You can do antimicrobials, again, not by your own self. You need a special person to understand if you have H. pylori, what kind of antibiotics you need, what kind of supplements is needed for you to take antimicrobials, in what dose, for how long. You cannot decide that on your own. So, but and like I said, if you start working on this, and if you start working on these first two steps for at least 2 months, you will start seeing improvements dramatically. Along with this, if you also do practice the emotional well-being, by the way, the ones who have not attended that, what we can do is it's free. The first level is free for everyone. We can do one thing, Yashashvi. Do we have the registration form for the level 1 of emotional well-being?
Yeah, we have.
Okay. So can you put this in the chat, or even and also in the Telegram group? People can register for that and then just attend it. Why I'm telling you guys to do that is because in that I have also spoken about how your emotional well-being can improve your digestion and your hormones. So you can start practicing those things along with these things, the first two steps for at least 2 months, and see the change. I'm telling you, 50% of your improvement will happen then and there. Like I said, it's not always complex things and multiple supplements that you need to take immediately to see the results. No. Even if you do these 2 or 3 things, which I'm telling you to do, you will see great improvement. Okay. You will lower down your inflammation. In thyroid response will improve. Bile will break down the food. Obviously, then you are getting better fat soluble vitamins. You are getting, your fats for your hormones to get balanced. It will just start working so beautifully for you. Gut lining is improving, then the immune system is also not getting hyper. So it's fantastic. These 2, 3 things also. So how food and supplements support the gut hormone healing? Okay, stomach acid supports improvement of your proteins, obviously, and mineral absorption for your hormones. And digestive enzymes will help you to break down the proteins, carbs, fats, everything, and reduce the bloating and insulin spike. Bile will help you to break down the fats and improve your estrogen clearance. Balanced meat and even bitter foods. By the way, bitter foods are going to be amazing for your liver health. So include them. Okay. So you are cleansing your liver, it will improve your bile. So fantastic for you. And like I said, beetroot is fantastic. Supplementation for any kind of a weak system. So better digestion improves the sensitivity issues and PCOS symptoms, and improve your estrogen clearance, and cycles starts regulating, the PMS starts reducing, inflammation reduces, it improves your thyroid function, obviously, antibodies will improve, and balanced microbiome lowers your chronic inflammation and hormone resistance. Gut repair is very, very important for your survival mode and your reproductive health at the same time. All right. So this is what actually I had to share. Now, the last thing is so 3 things. What did I mention? I will take down the questions and I will take down every question. Don't worry about that. Okay. Just want to tell you, number 1, you'll work on your emotional well-being. Second, you will start working on your stomach acids, enzymes, and biles and also your gut lining. For how many months? 2 months. You will see improvement, I promise you that. Okay. Now comes the questions. Okay. Can thyroid antibodies be reversed? Like I said, if you work on your immune system, yes, it can be. But if you keep on giving more triggers, and if you have not fixed your gut lining, you're not going to reverse it. And it takes long time. Okay, don't expect it to just go in 6 months. Okay, the years of damage that you have given, at least uska आधा time तो आपको देना पड़ेगा. Okay, what's the reason behind fibroid? I told already. Any test for low stomach acid, you can do, you know, testing for it, but very basic test at home that you can do is a burp test. It's not again a very sophisticated test. Just take a little water, add some baking soda in that, have empty stomach in the morning. Okay, if the burp does not come very easily, that means you have low stomach acid issue. You can do that. Okay, there are many videos available on YouTube. You can check through that also at home. Hmm? And endometriosis is also an estrogen dominance issue, which is again a problem of beta glucuronidase, which I spoke in that gut GI map test. It's a problem of that also. It's a gut related issue. Infection can also be there, by the way, in this. Okay. Can you please show previous slide once? I logged out. I'm sorry. Which one? I'm sorry. Yes, I go for blood test. Oh, by the way, the ones, yes, I go for blood test everything comes out, but yes, you feel bloated. So for bloating, you cannot come to know anything through the blood test. You cannot really know. Mishrin. Anila, can we have the recording, please? I'll let you know. Wait. Um, can advanced testing help you identify more about your thyroid antibodies? Yes, that is why I said the ones who have high antibodies, I tell them to do GI map test. I want to definitely see that. What kind of an issue is there? How to increase bile acid? Like I said, start taking your first work on the first step, okay, digestive enzymes, stomach acids, and everything, and then start eating beetroot along with your meals and see how it works for you. If it is not, then you start, taking bile salts after consulting a nutritionist, not before. Okay. Lemon water on empty stomach, yeah, you can take, no problem. Spurti, any kind of aloe vera will work, yes. B complex in vegetarian food, yes, you get that, but you can take an extra dose if your gut lining is weak. So you can take through supplement also B complex. It's water soluble, so there's no problem. It just flushes out through urine. You can go ahead with that. Any recommended brand for aloe vera? A lot of them are available here in India. Any good one you can buy. Even the normal fresh aloe vera also you can scrape and make a juice out of it. No problem with that also. Okay. What things to take for B complex nutrients? So of course, all your whole cereals and pulses and everything, whole cereals and pulses specifically, okay, they are good in B complex. But at the same time, like I said, if it is weak, your digestive lining is weak, you can take an extra dose of it. Okay. Can you please once again in short talk about lemon juice and aloe vera? So in aloe vera and lemon juice, lemon juice is not going to be improving your stomach acids, but at least you can begin with to see the tolerance. Once it improves, then you start with ginger, and then you start with apple cider vinegar to improve your stomach acids. Aloe vera helps you to smooth your gut lining. That's what it does. Okay. For beetroot, before food, yeah, no, you don't need to keep a gap. Just eat the grated beetroot. You can just perimenopause and digestion problems, yes, it can be there, but perimenopause not necessarily will give you digestion only. Like digestion problem hai to perimenopause hai. No, it's not like that. Okay. See, menopause is a different thing altogether. I have very less experience in menopause, honestly speaking. I have not worked with many patients, so it's wrong for me to give too many opinions on that. But it's like I said, digestion problem is giving you perimenopause, not necessary. But yes, perimenopausal women, and if you have digestion issues, oh my God, like then the patient will have problems in coping up with the symptoms, you know. Yeah. Boiled beetroot raw, anything will work. You can tolerate raw ones also. If you feel no, then you can boil it, no problem. Adenomyosis, low iron and slightly elevated TSH, usually scanty and period. Estrogen dominance can be there. So in such cases, I would do gut, and also after, like I'll work on this kind of a patient with normal blood test first, see how things are, how's the digestion, everything. I'll do a GI map, work for a few weeks, and then a few months maybe, and then I will go for the Dutch test and see if how your hormones are. I will work like that for this kind of a patient. I add the grated beetroot on yogurt and have it in lunch. You can do that. That's fine. Is it normal to have constipation in perimenopause phase? Yes, it is possible because the estrogen and hormones, basically hormones are suppressing, so that can be possible. What to do to reduce the bloating? Can you provide a diet chart or something? Oh, the whole point of telling this entire webinar was that only that there is no generic thing for everyone sometimes, you know. So if for your diet chart for specific for the bloating, I don't have any ready thing. But the tips that I shared just now, eating, chewing, simpler meals, apple cider vinegar, digestive enzyme, bitters, all, and also having beetroot, working on your gut lining with aloe vera juice and collagen, bone broth. Do these things. It's going to give you good results. But if you have SIBO, C4, or anything like that, and it's not getting improved, you need an expert for that. You need to come for consultations. Okay. By the way, I want to tell you guys one thing is that I am if anybody is interested in the one-on-ones with me, there is a waiting list for it. I take very few patients. I don't take too many patients. So right now I'm full. So if anybody is interested, please fill in the form. Sushmita or Yashashvi, either of you just put the link of that. You
Yeah.
can join the wait list, please. We'll put it in the Telegram group also and also in the chat. You can add yourself in the wait list, and once we open the slots, we are going to send an email to you. It's going the February batch is going to be open for you all. So whoever is interested can come, and then I'll take limited people and then open the batch in March. So one month I'm going to open like that. Okay. So any questions, any more? And how was the webinar? Did you guys understand? How was it? Please, I will also I'd want to know, like, if you guys found it useful, give me a brief about everything that I shared today. Was this informative? You found it useful? Thank you so much for that. I will open my chat. I'm sorry, I forgot to do that. I'll open my chat. You guys can write a review. And also, by the way, the next week, I also want to do another webinar, which is the topic that you guys want me to do the next one. Please write it down in the chat also. I would like to see what is the next topic that you guys want. I have opened the chat. I want all of you to please write down a review of this webinar, please. And you guys have any questions, I'm here. I'm ready to answer. Autoimmune conditions you want me to talk specifically. Okay. Skin problems. Okay. Webinar. Okay. Autism and how to treat. Okay. Endometriosis. Perimenopause, very tough for me. Where, like I said, very less experience. Allergies, yes, I can speak about that. Okay. All right. I can, yeah, you can write your questions, Purti. I'm here to answer. Hair fall suddenly. The thing is, there are like 30 people here, and if I answer one person like this, it's going to be difficult. Okay. So hair fall suddenly and high thyroid and how to improve. Like I said, check your if your iron is not improving and if your thyroid is not improving and if your antibodies are high, Shanaz, then probably, like I said, your if your I first is deficiencies. If your iron is low, zinc is low, you're not eating well, you're not there's no protein, then you will not see improvement at all. But if in spite of that you are feeling like this, then we go ahead and do the advanced testing. First is the basic, like we have to see if you're really eating well also or not. Are you really deficient also or not? You know, so all comes to that. Uh, how to be consistent for long without getting demotivated. So the motivation comes when you see your reports. Oh, I am pretty sure on that. That itself is very alarming for people. Like, oh my God, I have this kind of a problem. Then the motivation automatically comes and then the patient actually starts becoming serious. The problem comes only when, you're trying to do very generic things and you are not outdriven for your medical issues. I think people who are doing generic things like I want to lose weight, then they will keep, finding motivation. So motivation is a very over exaggerated thing, I believe. It's something that you want to do. So very recently, like I said, I did a event where the webinar where I spoke on the you know mental well-being and emotional well-being. In that, I spoke very well about the values. So the things which you don't value, you need to have motivation for that, honestly speaking. But things that you value the most, you will make out time for it. You need no motivation for it. For example, if you love sitting on your phone all the time and you love watching Netflix, you don't need motivation for that because you highly value that, honestly speaking. So motivation is something that comes natural to you when you value something. So if you want motivation, that means you are not valuing that, honestly speaking. Watch that video, the free webinar. Although I did that in the, I think, second or the second level. Yeah, I did that on level two, about the value system. The second day I did that, yes. So allergies and autoimmune energy levels. Energy is related to many things. Again, if you're iron deficient, if there is B12 deficiency, are you methylating well? Some of the patients are taking B12 and folic acid and still feel low energy. That means there can be a methylation defect. So your body needs a better thing. Okay, better form of supplement. Okay. Um, Tips for constipation. I gave the entire tips only for constipation, what to do. Not just the fiber food, which is like chia seeds, prunes, apple, stewed apple. These are the basics which I have spoken even on my reels. Do those things, but digestive enzymes low, bitters low, acids improve karo, keep some gap between your meals to see the improvement in your constipation as well. Don't keep snacking and expect your constipation to improve. Okay, keep some gap of 3 to 4 hours without fail. Supplements for perimenopause, not like generic. I'm not the right person to comment on that. Cost of GI map, it costs you at least 45,000 rupees, Indian rupees, if you live abroad and around like $500. Okay. Even the Dutch map is around that much. These are costly and expensive tests, but people who are lingering around and finding the cues and spending 10,000 every time doing the basic blood test, you rather do one and then get rid of it. Okay, that's why it's the best one. And it is a US based test. That's why it costs you in dollars, which you're converting into Indian rupees. So it costs you more. And if you live abroad, it's not covered by insurance also. Okay. So emotional well-being link in Telegram, please. Yeah, we'll give you that. Okay. Sushmita will give. Yashashvi, please put that for
Yeah, just
in the
putting
group.
it. Just two
Yeah.
minutes.
No problem. Yeah. I'm taking ghee on empty stomach with soaked nuts and dried figs. I have been having smooth and regular. Fantastic. Not much problem of constipation. Can I continue? Absolutely, Spooty. Go ahead. Please do. Something that is working for you, why you have to switch? Keep doing that. Okay, does ginger water have anti-inflammatory properties every time I it comes? Like I said, if it is working for you, please continue doing that. There is no right or wrong. What's right for you is right for you. Okay, please go ahead and continue taking your ginger. Ginger has antimicrobial properties also, anti-inflammatory properties also. So, which is why probably it's calming down. So, yeah, go ahead. Is it that temporary solution and not addressing the root cause? See, if you have severe cramps, it's unbearable, then yes, you are probably, it's hampering your daily life routine. Then it is a big problem. But if it is bearable, it is okay, no problem. Just do your basic. Like I said, you do your basics, like work out, do your things. Things are going to definitely help you, even that way. Okay. Any more questions? So two, three things just want to tell you. One, if you are literally at the beginner level and you need help, there are bundles available on my website. You can go and check that very easily. Just start doing those basics. Okay. That will also give you good results if you have not done anything so far. Okay. That is one. So you don't need my consultation or anything here. Okay. Second, of course, the webinar, the things I keep doing, you can keep attending and start applying those things. Second, for your emotional well-being, please enroll for the first level, which is free for everyone. Watch that. I want you to start working on your emotional well-being. There is a worksheet that I have worked in that. So work with me in that entire worksheet. I think I've done for 2 hours or 3 hours that entire thing. It was wonderful, and people really saw good results in their emotional well-being, like understanding how their pattern works. Work on that alongside, and whatever tips that I have given you. Together, it's going to work wonderfully. And then if you feel less, yes, I need Shikha, you have the wait list, you can join that, and whenever we are opening, we'll inform you. That's how the thing can work for you. Okay. White discharge issue. Now, if it is too much of a white discharge, then it probably is fungal overgrowth, candida overgrowth for you. If it's itching and it's like that for you, then it is fungal overgrowth. Excess of it, yeah, probably that. Then it is candida then. Um, it's just been 6 months of your postpartum. Wait for one entire year. Sometimes it takes longer also for so many people. So wait for it. It's too early for you to expect the periods to come. I got in first month only. I have seen patients not getting for one year also, 1.5 year also. Don't worry about it. How can it be treated? What can be treated? Oh, candida overgrowth. You have to do an antifungal diet for that. Not eating any kind of fungal foods, anything which is first, like I said, but is stomach acids, digestive enzymes, bile. These are the primary things. Chewing food, ये तो primary है. Gut lining needs to improve, and then you do along with that candida, anti-candida diet. Okay, antifungal diet. If the gut-brain axis is not aligned, can it be affected with diet? Of course, it will. It will. It, and that is why in such cases you do GI map testing. Okay, because there are sometimes a lot of bacterial overgrowths which probably is affecting your mood also, and then you keep questioning, no, I'm actually not trying, I'm trying my best to not overthink, but it is coming to me. I'm trying my best to not have anxiety, but it is happening. GI map link you can't get directly there. You need a prescription from a functional practitioner only. You can't just buy like that. So generally, whenever I have one-on-ones, I give the link to my patients accordingly. And वैसे भी वो टेस्ट आप करोगे क्या? You need a functional doctor or a nutritionist any which ways to work with you. You will not be able to understand things. It's a little complex. I recently had a fibroid surgery at the age of 29. How can it be prevented? You have to work on your estrogen. You have to work on your beta glucuronidase, on your gut. Okay, digestion has to be improved. Commensal bacteria have to be good so that you're not reversing back the estrogen. No ways that you should have constipation, not even one day, not allowed for you. That has to be good. Fiber intake अच्छा रखो, पानी अच्छे से पियो, and estrogen backflow नहीं होना चाहिए. That is your main concern. If it is going back, now then fibroid होने के chance तो बढ़ेंगे वापस से. Apple cider in vinegar before the meals if you have bloating issues, just before the meals or with the meals. Can uterine fibroid be cured without surgery? Yes, you can, but it'll take very long time. You can do the surgery, but at the same time, you can work on, like I said, the reversing back. That will be amazing. Because I had three of my cousins who had fibroid issues, family history. They all did fibroid and then they conceived and everything, but they didn't do anything as such for their gut health. So it's just, coming back. They're always at risk. That's what it is. Acute pancreatitis and gallstones be reversed? Not necessarily. Acute pancreatitis, you need, like I said, you need digestive enzymes in such cases. For sure, they have to be supported for their insulin. Okay. And if you have gallstones, if you start working on your liver, like, liver detoxification, digestion is good, you're not giving too much pressure, and do not eat too much fats. Okay, like a moderate fats, and with the bile salts, if you support it, it will slowly, slowly, slowly start dissolving. It will. Yeah, he has to take bile salts if the gallbladder is removed. Yes. Yes.
Shikha, you can stop the recording if you want.
So these questions I'm answering purposely on the recording so that others can see. Okay, the recording part, I'm going to give it to you guys for, like I said, 2 days. Okay, chalo, let me be a little generous and not just give you for one day. I'll give you for 2 days. But after that, the access will be removed. So if you all want to watch it, you can do that. Okay. We'll put it up in the group. But see, please don't try to see the recording later when I do the webinars always. Huh? The reason why, when you do the live sessions, you can ask your questions and understand the concepts better. I know when you people watch recording, it's like 10x speed. And I know then people will stop registering for it. If I see people are not registering later and watching just that, I will stop giving the recording, honestly speaking. I want people to come and listen. It's important. Okay. I think no more questions. Bile salt is exactly, it's a supplement only, dear. It's made from bile of the ox. Okay, so it's a non-veg product. You will find bile salts very easily on Vita One also. Yeah, can find very easily. Even that, what is that? What is that brand in India? I forgot the name of that brand. Okay, we can just take from Vita One. I don't remember the other name. Okay. I'm planning to do the next webinar probably next Saturday again. Does this time suit everyone? I'm in India right now, so there's a time for me where I can actually manage very easily. So most of the people are like, registered for this time, so I think I should be okay. This is actually lunchtime for everyone. So I think this should be good. So we can do next week again around the same time. It'd be amazing. Evening works better, but I think I will not be able to focus completely because I have a small baby and I don't want too many interruptions and I just don't want to hurry and do things. Right now, I can manage, in this time. All right. So, yeah. So next week, again, we'll meet up for another session. Uh, and I hope that you guys have written some testimonials on the group. Thank you so much for that. Yeah, I saw that just now. Thank you so much. I'll keep it open for some more time. Please write your reviews. It'll be very helpful for me. And just the last question I'm taking is, what is fatty liver? Fatty liver is basically the fat that is getting accumulated on the liver. It's mainly because of over indulgence of carbohydrate or also because of insulin resistance, most probably. Okay, so because of these issues, uh, 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 the fatty liver can happen in the first place. Also, alcohol. Okay, all right. So, yeah, I think I'm good to go. And I will see you guys in the next session very, very soon. Thank you so much, guys. Bye. Okay, switch on. Yeah, done. Bye, guys.